Hello, everyone. It's so good to have you back with us again for our Mount Diablo Parkinson Support Group meeting. Now, before we get started on our program for today, and we do have a really good, strong program, I want to cover a couple of things with you here. First, I want to invite anyone who would like to join our group to please have them go to our website, which is PNMD.net. Now, let me repeat that again, PNMD.net. Now, on our website, you will find information about our annual dues and phone numbers in the event that you have any questions. Okay? Now, the next thing is, most of you know that I'm associated with the Michael J. Fox Foundation, and periodically they update me on what they're involved in with Congress and et cetera, et cetera. And I'd like to read you a recent email that I received from them, again, updating us on what's going on. All right, the Michael J. Fox Foundation is talking with members of Congress and their staff to ensure that the Parkinson's disease population is considered as work is being done. Specifically, in collaboration with other patient advocacy groups, Fox Foundation signed on to letters sent to Congress and federal officials regarding paid medical leave for caregivers, supporting an expansion of telehealth opportunities for patients seeking care, and extending the deadline for Social Security beneficiaries to submit their taxes so their dependent children can receive economic impact payments. Additionally, the Fox Foundation sent letters to the Department of Veteran Affairs urging them to not transfer nursing home patients without informing the families about a new site of care, and to Congress calling for mental health access legislation to be included in an upcoming relief package. Now, lastly, but certainly not least, and this is entitled Breaking Telemedicine News for People with Parkinson's. Now, this month ended with another announcement from CMS. Now, CMS stands for Centers for Medicare and Medicaid Services. Now, from CMS giving additional access for patients and flexibility to telehealth opportunities. Now, listen to this. CMS now allows physical therapists, occupational therapists, and speech-language pathologists to deliver telehealth services. Medicare will pay for many behavioral health services that are conducted by audio only, changes that are providing safe and wide access for patients to seek medical services. And they're waiving the video requirement for telehealth services. How about that? That's great news. It really is. That you can actually receive now physical therapy, occupational therapy, speech therapy, that type of thing through telehealth. And some years ago, and it still is referred to as telemedicine. All right, so that at one time was not covered by Medicare or Medicaid, but now it is. All right, now let's move on to our really great program, as I alluded to today, starting with our own Jody Berry, who, among other things, is editor of the Shaky Times and the availability of exercise for PNMD members. Now, following Jody will be Lena Hart. Lena is an MSAT certified teacher of the Alexander technique. She has also been working with the local Parkinson's community for over a year with group classes and through private lessons at her studio in Walnut Creek. Now, the Alexander technique, as many of you know, is an educational method used worldwide for well over 100 years. By teaching how to change faulty postural habits, it enables improved mobility, posture, performance, and alertness, along with relief of chronic stiffness, tension, and stress. And boy, during these times, don't we all need that? Now next, our own Rick Stevens, our librarian, to update you on our library and our PNMD website. Okay, so Rick's gonna fix you up with all the info that you need on both of those areas. Now next, Dr. Jared Popejoy, who is director and founder of Nordic Walking Nations. Nations Nordic Medical Pole Walking is a home walking program that can be done indoors or out with your caregiver, family, or friends. Now, studies show that Nordic walking improves mobility in Parkinson's disease and suggests that Nordic pole walking could provide a safe, effective, and enjoyable way to physical activity in Parkinson's disease and to improve the quality of life. To conclude, we will hear from Erin Daly of UCSF, Center Administrator and Research Coordinator, National Parkinson's Foundation Center of Excellence. Erin manages outreach, education, and research for the Parkinson's Center as part of the Department of Neurology at UCSF, and will be providing answers to frequently asked questions from members of the Parkinson's community. Now, I'll be back after Erin to give you a sneak peek of our June meeting, so don't change that dial. Now, it gives me great pleasure to begin our program with our friend, Jody Berry.